If you have a partner who snores, you know how annoying that can be. But when is snoring a sign of something more serious? Our Dr. Frank McGeorge is here to explain when you should be concerned and seek help. Doc, help us out.
Well, Kimberly and Damon, in fact, snoring is very common. Almost 60% of men snore and about 40% of women. But of those, 25% are considered habitual snorers, meaning they snore loudly at least 3 nights a week. In those people, we worry about a condition called sleep apnea.
Serious snoring can be a sign of a sleep disorder.
Snoring is really the sound that is made by the upper airway muscles when the airway is collapsing. And when we see the airway collapse in sleep, we call that sleep apnea, typically obstructive sleep apnea. So snoring can be a disorder in and of itself, but most people who snore have some degree of obstructive sleep apnea.
Dr. Nancy Foldbury directs the Sleep Disorder Center at the Cleveland Clinic and says certain symptoms can make snoring more concerning. That includes snoring at least 3 nights a week, very loud snoring, snoring with gasping or choking sounds, and frequently waking up at night. Also, daytime drowsiness, lack of focus, morning headaches, and high blood pressure. Seeing a doctor is important to diagnose any sleep disorders, including sleep apnea.
Most recently, we've learned that people who don't get at least 7 hours of sleep per night, and this includes people with sleep apnea who have a lot of sleep disruptions, are at higher risk to develop dementia over the course of their lifetime when they get older.
Now, of course, snoring can be caused by other factors too, like having a few glasses of wine, or if you're sick or suffering from allergies. In those cases where it's temporary, it's probably nothing to worry about.
So is there any way to reduce snoring if it's not serious and just annoying?
Well, so there are some simple things that you can do. Basically, that includes weight loss, maybe avoiding alcohol at night, and changing your sleep position. Now, if nasal congestion is part of the problem, those nasal strips or maybe a decongestant can help. Your doctor might also recommend some specific snoring mouth guards that can increase your airflow, and some of them are even simple little bite splints that bring your jaw, change the jaw position a little bit.
So that you can breathe it better. Okay, Dr. McGeorge, thank you.
Sure.